Welcome to the Orthodontics and Interview Podcast, where Farooq brings you closer to the experts in orthodontics so we can hear their story and learn from their experiences. With your host, Farooq Ahmed.
Welcome to another episode of Orthodontics in Interview. I'm really excited to introduce my next guest, who is Neal Kravitz. Now, a little bit about Neal. Neal is the Associate Editor of the Journal of Clinical Orthodontics. He is a diplomat for the American Board of Orthodontics, a member of the Edward Angle Society of North Atlantic Component. Neal has also spoken recently at the AAO meeting. I know it's a presentation about what I wish I knew. That's also been covered in one of my podcasts, so please do check that out. Neal's also published extensively. He's had a recent publication in the AJODO covering aligners. So Neal, without further ado, welcome to Orthodontics in Interview.
Thank you. So I'm excited to be here.
Thank you so much for joining me. I really do appreciate it. And what I wanted to describe was the end of that introduction, really, as a first question. So you had this publication in the AJODO looking at the efficacy of aligners. Now, looking back at things, you've also had the publication from 2008 and 2009 looking at aligners as well. So I really want to know, where did your interest in aligners come from? What led you to look at this publication?
Sure. No, I think at the beginning in residency, we had access to a tooth measure software that was very unique for a program to have access to Invisalign's tooth measurement software. Was unique, and we took advantage of it with the study to come up with really a prospective clinical study to evaluate the efficacy of tooth movement. There really wasn't any studies out there. And then, Invisalign has improved. I think Invisalign gets a little bit of a bad rap amongst academics, but the truth is it is a good product, and it's a product that does do a lot of research and self-assessment and improvement, and it is improving as a product. So we really wanted to see where it has improved with newer technology and improved operator experience. So it was a redo of that study. Mm-hmm. And instead of doing PVS impressions, and we had a lot of challenge in the initial study with superimposing on second molars, because when you're taking that PVS, it pulls away from that second molar. But with digital scans and now newer aligners and smart fourth technology, we really wanted to see if it had improved. You'll see a lot of comments when research is published where people will say, well, that result doesn't matter anymore because they didn't use smart force aligners or et cetera, or et cetera. The reality that we proved is that it really doesn't matter with the newer technology. There are some movements that Invisalign really struggles with. And actually, I have a follow-up study that I'd like to see, because Invisalign seems to struggle great with rotations and great with lower incisor intrusion, but particularly for adult non-growing patients. And I actually think for teenagers, it actually does pretty well with deep bite correction. And I'd like to see if the challenges have a little bit more to do with growing versus non-growing patients when it comes to lower incisor intrusion. So I have a lot of interest in it, and I hope people find, I try to make those papers, even though they're research papers, clinically relevant, and I try to throw in some clinical pearls throughout the research.
That's really interesting to get your take on the papers and the time that passed in between them, and the take-home message that I'm receiving, that actually, although the material has changed, actually this technology of aligners, perhaps looking past the actual company of Invisalign, has some limitations associated with it.
Certain really movements are just challenging in plastic, right? Certain movements are going to be hard. Rotations, premolar rotations, canine rotations, molar rotations, and particularly incisor intrusion on non-growing patients. And it's not just with our study. You'll see this played throughout on other great studies that measure efficacy of tooth movement.
Yeah. And I think sometimes that can come across as, well, either you're not supporting aligners or you are supporting aligners. And I think actually the reality is that we struggle with certain movements with fixed appliances as well. Distal icing is a really difficult movement to do with conventional edgewise and fixed appliances. And I think it's about acknowledging those limitations. And then actually you've got a platform to work around them then, I think is really insightful. And your paper really helped, I think, me understand how aligners work.
Yeah, I'll tell you, I try very hard in the paper to not come across as biased. I actually try to come across, I wouldn't want anyone to read it and say, Neal is trying to be anti-Invisalign or anti-clear aligners. In fact, I have done almost 4,000 Invisalign cases. So we do a lot of Invisalign, in fact. So I try to be very right in the middle, and I would hope there isn't too much disagreement from either side, people who are completely opposed to aligners and people who use aligners a lot. I hope people say, listen, these are just areas of struggle, and if we can focus on them, we'll continue to improve as providers.
Excellent. So Neal, just touching upon some of your other publications, you had one with Jay Bowman in 2016. It was a great paper. I do suggest people download it, have a look at it. It was a really good opinion piece looking at straight-to-consumer devices for orthodontics. Now, this was 2016, and I just wanted to quote one or two lines from that paper and gauge your opinions to where perhaps we stand today. So in that paper, you mentioned that today competition and greed has trumped professionalism, and that the traditional model and relationship of marketing still remains effective at that point in time. So that was, as I say, a few years ago. What do you think, Neal? Where do you think this straight-to-consumer is going? And do you think the profession has a chance now to revert that process?
Yeah, it was thank you so much. That was a fun piece to be able to write with not only a good friend, but someone that I really look up to as an exemplar. Jay is just this perfect combination of masterful clinician, but academic, and teacher, and lecturer. I could talk about him for the entire interview. I care about him so much. So it was very humbling for me to be able to write with him. And it was a piece that was a little bit hard to write in the sense that we were both very passionate about it, and we're trying to get our voices out on that piece. I think what we were trying to say is, listen, the Invisalign changed the game, right? Damon changed the game. They said, you know what? We are going to bypass even orthodontists and go directly to patients. So imagine like in the 1980s when pharmaceutical companies used to try to sell their medicine and promote their prescriptions to physicians by giving them pamphlets and saying, buy our medicine or prescribe our medicine to your patients. Now they just go right to commercials and they just tell patients, ask your doctor about Zoloft, right? So we did that in ortho, right? Patients would come in saying, I want Damon. Patients would come in saying, I want Invisalign. So that really forced the hand of orthodontists, and they would start using these brackets or using these clear aligners because patients were coming in asking for it, and they would just choose a provider who would offer this. And that really set the tone. So the 1990s and 2000s with Damon and Invisalign really changed the landscapes. But something has happened as Smile Direct Club and all these companies have really started to go directly to the public. The AAO and orthodontists have said the only way to fight this is not try to re-educate a patient when they're in the room at a consultation, even if they even come in for a consult. They may not even come in. We need to go directly to the public ourselves. And the only way to fight misinformation is with direct-to-consumer patient education. So you're seeing the AAO get involved with social media marketing, and we're going directly to the public with how we feel about products and myofunctional appliances and all these things. And so here's what I will tell you. I think the landscape has been changing for almost 20 years, right? Maybe even more, where product companies are bypassing the doctor and going directly to the patient and the patient is researching a provider. And finally, orthodontists are saying, we are done soliciting dentists who are providing orthodontic services themselves, and we are going to solicit the patient or educate the patient directly. And I think the name of the game is no longer this hang a shingle marketing where you beg your dentists for referrals, and if they tell you they don't want teeth pulled, you wax and wane and apologize and modify your treatment plan because you don't want to upset them. Now, the dentists who are providing orthodontics and the companies that are going right to patients, they've forced our hand to go to patients ourselves, and I think that is good for us. And I think it has only strengthened us as orthodontists, and realize that we actually don't need dental referrals. Our communities, I always say, I refer the dentists, not the other way around. They need my referral, not the other way around. So I think direct-to-consumer marketing is not great because there's misinformation. Direct-to-consumer marketing by product manufacturers is not great because there's misinformation. But the way we fight it is we go directly to consumers ourselves. We go to the community ourselves. And I think social media has allowed us to do that, has allowed us to put ourselves out there. We no longer rely on dentists for referrals.
That's great. Now, Neal, just changing tact, I wanted to ask you about your clinical preferences. So if we were in a desert scenario and you had to choose one appliance to put on this patient to be able to get off the island, what would you choose? Self-ligating appliances or conventional ligation?
Yeah, I've used both, and I'm pretty familiar with both. I'm a conventional ligator. I just seem to like them more toward the end of treatment. So I think honestly they're both great, and they're fine. But if you're asking my comfort level, what I like when I detail, I'm always just more comfortable with conventional brackets and my ligation ability. I always almost feel a little handcuffed when I'm trying to finish in detail a self-ligating case, maybe one that's transferred into my office. And I'm very familiar with those brackets and all the popular companies. I'll treat those patients and I'll keep those brackets on. But I do feel like when I'm finishing and detailing, I much prefer a conventional system.
That's great. A bit more about Neal now, the person. So, on Netflix, on TV, what is your favorite show? What is it you're watching at the moment?
Oh man, listen, we have little kids. We are watching nothing but kid
Disney
shows at home. Disney at home, Transformers, Ben 10, all the cartoons we watch. If we get any chance to watch anything, obviously now everybody's watching all the political shows, so that seems to be on. But I'd love to tell you there's time for that. But my children own the television. So
Neal, if I knew this, I've got 2 young kids. We could have had a whole interview at Ben 10 and Pokemon.
I got no say.
Neal, another interview. Next interview.
All I want to do is watch sports, and I get no. I don't listen. I just try not to get yelled at when I get home. So I give up the TV.
Oh man, we live 2 same worlds in different places. Okay, so carrying on from that, Neal. So what is it, dare I ask, what is it you like to enjoy? What do you enjoy doing with the family?
Yeah, no. So right now we're still pretty quarantined. So we are a lot of our pastime with we have 2 boys and a young girl. We do a lot of Legos and a lot of building. That seems to be something that we can do together inside the house. So the Legos get pretty intense, and we it's pretty amazing the amount that we have. But that is something that can take up a few days and a few evenings when I get home. So we are a Lego building family in the evening.
Excellent. So now looking a bit more reflectively, I suppose, in your career and what's led you there. Who is it that you admire the most in orthodontics?
Well, listen, there isn't just one. I mentioned Jay, and he is at the top of the list. I have my great friend, Sean Miller. You'll see a lot of papers where I write with Sean. Sean has been by my side since dental school and has kind of always been just a great friend and resource. But I really look up to so many people, and I get something different from different people. And at different times in my life, I seem to gravitate toward different individuals. I think Steve Siegel, Dave Harmon, these are local orthodontists in my area that I really just look up to so much. I've really relied on the knowledge of Vishnu Raj over the last year, and have really enjoyed my friendship with him. So there really is so many people that I look up to, and I think it's important to have a lot of mentors. And I will tell you, I think early on, I did not feel comfortable asking for help or asking for advice. And as you get older, you realize there's a lot of people out there who are just brilliant and much smarter than you are, and have a good grasp over challenging cases or situations or life experiences, and they want to help, and they are always willing to. So I the answer to your question is there really are so many. And the number just keeps growing every year, and I've gotten better at asking for help. But I think maybe over the last year, to give specific names, I'd love to say Jay and Vishnu as two names that come to mind.
Fantastic, great people. So coming towards the end of the interview now, Neal, what one piece of advice would you give to the orthodontists out there?
I'd love to. I'd also like to kind of mention Mark's name on that. Well, excuse me for just not being prepared on that question. Mark has also been someone I communicate with almost daily, and has just been a great friend.
Is Mark with him here?
Of course, yes, of course.
The only one.
If he's listening, Mark, say hello. So no, but he's been just wonderful, and he's been right there by my side on so many questions and situations. So. Can you repeat the question again one more time?
Yes, of course. What one piece of advice would you give to orthodontists out there?
Well, I think the one that I had to learn, which is just stay humble. I think it was so I was so misguided when I started, and this is what I talked about the AAO lecture, that I felt that I had to really fake it till I made it. It's something that's preached throughout dental school. I did so to kind of create this bravado to get through all the stress of opening your own practice and running your own business, and the reality is, when you fake it till you make it, when you fail to be humble, you fail to see mistakes that you are making, or you are slow to catch on. And I think my great regret in orthodontics is not that I've made mistakes, and I've made so many mistakes, but that I've had to make them many times over a long span, almost 6, 7, 8, 10 years, before I realized that these mistakes were not happening in spite of me; they're happening because of me. And I think when you are really blinded by practice growth and case starts and money, I hate to say that, you really are not looking at your work and your errors the way you need to be. And ultimately, what I really needed to do was just say, I'm not the greatest orthodontist. I make mistakes. The guy up the street, who I am so hard on in my mind, is better, and I need to be better to do that quality of work. And the great thing about really rediscovering humility, because we really try to strip that humility to gain confidence to treat patients right away at a young age. But actually, once you relearn humility, the great part about it is your work gets so good so quick, because you're really committed to the details. And I really had to learn to not focus on money. And I also really learned not to become enamored with those orthodontists that were playing that game. So the guy who talked about the number of offices, or how many millions he made, or how many scan centers he owns, I just, those people no longer became people that I looked up to. And actually, the Marks and the Vishnus and the Jays of the world, those became the people that I looked up to. And I really had to look at my work. So if I could give a piece of advice, is really continue to be humble, not doubtful, but I mean humble, and not think you're the greatest, not think, not think that your work is untouchable. And if things aren't going right, if someone does have a critique, instead of being defensive, saying, maybe they're right. Maybe there is room for me to improve, because if you focus on it, boy, it's amazing how much my work has improved over the last decade. And I'm proud of what I'm doing right now. I really am proud of my orthodontics.
That's such good advice. And just in the conversation that we had, Neal, before we started recording, I was just mentioning to Neal his lecture, the AAO, was something that I really, as a relatively newly qualified clinician, only 5 years, really connected with. Is that Neal stood on that stage, well, virtually sat on the stage, and said that he had made mistakes, and it was the first time I'd heard somebody on such a large scale, on large platform, actually describe mistakes and what they learned. And as I said, I had a real connection to that. So Neal, thank you so much.
That means a great deal. Thank you so much. That means a great deal.
It is a message which should be resonated. It's just a really, really down to earth, practical. It transcends orthodontics. Like, it's just so good. And I really appreciate you coming on here.
I'll tell you something about that talk. I'll tell you. I got thousands. I mean, really, an overwhelming number of responses. You get a few every lecture, but a number that I couldn't even imagine. But I'll tell you, there were a handful, only because you never get any. I got a handful of comments that were not supportive regarding the extraction section.
I don't.
Wow. Well, it was okay. I mean, and some of them were interesting, and and perhaps maybe my delivery could have been better. But I just. I will tell you, we talked about lessons. If there is a young orthodontist listening, and this is maybe not so much of a problem outside of the United States, but for those inside the United States where we really are reluctant to teaching extraction treatment and providing extraction treatment, my greatest regrets, the cases that I would give any amount of money to redo, I still have rapport, the patients still love me, but I really caused damage to their teeth. I did this. Were cases that simply needed extractions done. And I am amazed that we still have this Calvin case, Edward Angle argument, from 100 years ago. Clearly, the case argument holds true that we need to extract teeth some of the time. And I believe I extract in about a quarter of my adolescent patients. I tried to limit it on the adult patients and be very selective, but some of my great regrets is not really extracting when I needed to. And all those cases, all the cases with root resorption and excessive proclination and open bites and relapses and ankylosis and extended treatments, these are all cases that simply needed serial extraction. And boy, those are tough lessons to learn. Remember, that faculty member that you think is just a little too old-fashioned, well, that faculty member has a lot of wisdom, and I am becoming very old-fashioned in my day. And there really aren't any shortcuts, and I think we are going to have to rediscover some of the principles of our past orthodontic teachers.
Amazing. Neal, I'd like to thank you so much for joining me on this interview. I'd like to thank the audience who have made it possible, and thank you so much for your feedback over the past few months since we got the podcast going. Please look forward to the next episode, and we'll speak to you soon.
Thank you.
Now, just a few outtakes from my interview with Neal Kravitz. So, Neal, it's great to have you here on your first interview with me.
Thank you. Oh, well, yeah, my first interview was with Lance, but this is my second interview.
Neal, I don't know what to say. I feel betrayed. I don't know what to say.
Well, I'm having a great time. If it means anything, we'll tell Lance that I'm having a great time with you.
I won't be talking to him again.